This is the NEU's weekly report on COVID and schools. This week focusing on the big increase in outbreaks in schools and the big increase in the number of children self-isolating. 375,000 children off school. Outbreaks in schools now at the same sort of level they were in the autumn. The silence of the DfE is simply disgraceful. On this chart showing all ages from the coronavirus infection survey, you can see it's no longer right to describe the level as low. It's not at the peak it was in January, but it's off the floor and it's doubling every 11 days. And that's true in all the countries of the UK, and it's true in all the regions of England, although you can see it's higher in the northeast, the northwest, and now in Yorkshire and Humber. This week, the Marmot report on COVID deaths in Greater Manchester suggested there might have been 25% more deaths than in a similar population elsewhere. And the explanation for that is COVID is worse in poorer communities. Fewer people can work from home, housing is denser. It might not be leading to deaths right now, but it is leading to more children being off school. And we can see here that the school age population increases are, you can see them on this chart. For primary, or for actually from age 2 to school year 6, the blue line, you can see it going up sharply. It's at the same place it was at the 30th of September last year. You can expect that 1 in 140 of the pupils you're teaching have got the virus. In secondary, for year 7 to year 11, you can expect that 1 in 120 of the children that you're teaching have got the virus. That's the national average. It varies from place to place. When we look at the comparison with all ages, you can see that school age children are now racing ahead of the all age average. When we look at PCR tests and this log graph, you can see that there's a straight line on the log graph, and that means exponential growth. And the R rate is above 1 everywhere. There are a third of the country, 90 districts, that have case rates now of 200 per 100,000 or more. And that's a third of the country in that sort of situation. Now this doesn't necessarily lead through to hospitalizations and deaths. And the hospitalization curve is still quite flat. Although when you see this log graph, you can see it is increasing at an exponential rate, but just at a much lower rate than the cases are going up. And deaths continues, thankfully, to be much flatter. Every death, obviously, a tragedy, but much flatter. And its log graph is also less certain. So the vaccination is protecting against hospitalizations and deaths. But where the vaccination isn't protecting is outbreaks in schools. And this chart of outbreaks shows that the number of outbreaks last week was double the number the week before and double the number the week before that. There were outbreaks in 78 primary schools, 112 secondary schools and 18 special schools. And that's all leading to children having to self-isolate. And this graph shows the simply enormous increase compared with what happened after the 8th of March, when we were probably still on the Alpha variant, and at the low levels of Delta that happened just after Easter. Now we're into a very sharp phase of increase due to the Delta variant, and huge numbers of children having to be off school. The total of these numbers on here, 375,000 or more, and there is every chance of that number being greater next week and the week after. So that's why we're asking, where is Gavin Williamson? He should be on the media advocating for mask wearing in schools. He should be advocating for parents to use lateral flow devices to see if their child is an asymptomatic case. He should be advocating for ventilation in schools and investing in ventilation in schools, because we want to keep these cases down so that children don't have to isolate. This chart shows that the lateral flow use has really fallen down. That's why we want Gavin Williamson speaking up for it. The good news slides are that vaccination is continuing to spread, and we are at a place where well over 60% now of the adult population have had 2 doses, and approaching 90 or more percent have had the first dose. And so that is good news, and the vaccination is protecting. And we know that school staff are really keen on getting vaccinated. The bottom 2 lines here are about 1 dose vaccination, and this is statistics that we got for the end of May. And you can see that despite school staff being younger, they'd managed to have more of them getting vaccinated than the adult average. So 87% of school staff had got vaccinated compared with 75% of all adults. But being so young, they hadn't managed to have their second dose yet. And you can see that school staff were behind the all age average in the top lines of getting that second dose. Hopefully, by the time we reach the end of term, every member of school staff will have had a first dose. And hopefully by the time we get to the end of August, almost everyone will have had a second dose. Let's work for that. We know that parents support vaccination of school-aged children. The bottom line here for secondary schools in particular, you can see that well over 50% of parents say they would definitely get their secondary-aged child vaccinated. Then another great proportion say they're unsure, but probably yes. So we know that parents support vaccination of school children. The NEU is continuing to maintain its school COVID map, and there are many other resources on our website. Please share this video. Thank you for your support.